Good afternoon and welcome to our daily media briefing. Today we're going to be hearing from Supervisor Fletcher and then followed by Dr. Nick Infantides, our Chief Medical Officer for the County of San Diego. But before we get started, I wanted to start off on some good news that I'm sure we could all use at this point in time. Today we're announcing a partnership with Rady Children's Hospital and the Rock Church on a program to collect, track, and distribute donated medical equipment that is critically needed to support healthcare providers across the region during this crisis. To learn more about it, I'm going to introduce our partners in this effort, and that includes Miles McPherson, the Senior Pastor of the Rock Church, and Steve Jennings, the Senior Vice President and Executive Director of Rady Children's Hospital. Gentlemen.
Thank you. Thank you.
Thank you very much. Many of my thanks to both County Supervisors Cox and Fletcher for their leadership here. And I would like to thank the San Diego leaders and community first responders for their unwavering support and commitment to the people of San Diego. Normally when I speak publicly, I like to share stories about our latest breakthrough at Rady Children's or our treatment successes. But today, we are really about the community and this partnership. Today, I'm honored to join with the county and Rock Church to be part of this inspiring collaboration to help protect and collect our medical equipment that we can supply to our first responders. Keeping our healthcare providers protected and supplied with the equipment they need to care for us all will enable them to continue to do their job safely, help reduce the spread of infection throughout our community, and be another step forward in restoring San Diego back to normal. We are proud to join together with several county agencies and the Rock Church to support our healthcare professionals so that they can best protect themselves, their families, and their patients. I can't overstate how deeply grateful we are to those that have already reached out with offers to donate PPE. I look forward to our team hearing from many more San Diegans for this type of support. For those of you that would like to make a donation or find out information, you can call 1-800-258-0007 or email donatecovid19@rchsd.org. Our team at the Rady Children's Hospital Foundation is eager to answer calls and emails from local companies and individuals and the public looking to donate new, sealed, personal protective equipment. Together, our community can move quickly to address the critical PPE needs and ensure our ability to provide uninterrupted, high-quality health services to our families, friends, and neighbors across San Diego. And now I'd like to introduce my new friend, Pastor Miles.
Thank you, thank you, thank you. How you doing, San Diego? And thank you, Steve, and thank you, the county. I'm Miles McPherson, pastor of the Rock Church, and it's an honor to serve our city. You know, over the years, we've been through, as a city and county, through a lot of things, nothing like this. And I want to encourage all of us to keep the faith. Trust in the Lord with all your heart, lean not on your own understanding. In all our ways, we must acknowledge him, especially in times like this. We've never been here before. And the only way we're going to get through it is if we stick together. I want to encourage all of you who have PPEs, you have access to them, to call that number. They will be screening them. We will eventually collect them and get them to the people in need. And I want to thank all the people, all the churches, all the organizations working together to keep our city safe. And before I go, I just want to say a prayer over our city. You can just look to me right here and say, Lord, I pray you protect us. I pray you comfort us. I pray that you calm all the fears of anxiety in all of our hearts. In Jesus' name, amen. Things are going to get worse, so they all say, but today, let's take care of today and not burden our hearts with too much concern about tomorrow. Let's be careful today, take care of ourselves today, be safe today, and I know God's going to take care of tomorrow. Thank you very much.
And again, I want to thank Rady Children's Hospital and the Rock Church for the great job that they're doing in stepping up to support our doctors and nurses and other healthcare professionals who are certainly on the front lines courageously fighting this effort and battling the virus. And I want to thank the many individuals and corporations that have already donated supplies and equipment for those who are going to be donating soon, hopefully. With that, it's going to obviously it's going to take all of us working together, as so many people have said, but together we will win this battle. So with that, let me get right to our speakers, starting off with Supervisor Fletcher, and then we'll get a medical update from Dr. Efantides.
Thank you. Good afternoon. As we start the month of April, we're going to go through our updates on numbers, and then we're going to talk a little bit about the significance of April in terms of the broader trajectory of San Diego County. Let's start with our total new cases and total cases for present. We have 115 new positive cases. That brings us to a total of 849 for our region. And again, the day-to-day numbers are less important than the week-by-week numbers. And as we progress through this, we'll be in a better position to assess and tell you what all of those mean. Second chart let's take a look at here is the number of tests. And again, we continue to stress that it is the broader trends and not so much the day-to-day numbers because of the way things are batched and reported. I would like to point out there was a story that was out today that said San Diego County is at the very top of California counties and the number of tests being conducted per 10,000 residents. We want more. We will fight for more. We will continue to aim to get more. But the residents of San Diego County should at least be pleased that we are best represented in terms of our testing capacity, and that is a great tribute to our healthcare system partners, our labs, and our county staff. Hotel rooms, not a huge change here. Again, the public health rooms, just to reiterate again, are for individuals who have a positive test, person under investigation, or unique individuals with symptoms awaiting further evaluation. Regional task force on the homeless rooms are for vulnerable homeless or families, and we will continue to assess those. Nurse triage line continues to be called frequently, as you can see on the next slide here. Along with the EpiCall coordination, hygiene kits, we continue to distribute hand washing stations and portable toilets. The next slide is the efforts around our personal protective equipment. This is obviously a subject that is in the news considerably and is greatly on the minds of all of our healthcare providers. We have now moved almost 500,000 N95 masks. These are things that have been sent out of our county door to our healthcare partners, along with, as you see, more than 500,000 gloves, face shields, surgical face masks. We are now well over 1 million items of personal protective equipment that have been distributed. We continue to fight and get more from every possible place we can, and as we get more, we do everything we can to get folks what they need, and those efforts will certainly continue. The last slide we have here in terms of statistics is available ventilators. You can see a slight tick up from yesterday. We're at 533. Again, to put these numbers into context, these will fluctuate every day. We now have 22 of our 23 hospitals reporting, and we greatly appreciate their cooperation as we daily assess the regional capacity and availability. COVID-19 is not the only thing that requires the use of a ventilator, but this is an important metric for where we are as a region. And so we are at 533. Our number in our county stockpile ready to deploy has ticked up to 80. Again, the ones we have out for service get returned, and add to that, along with the requests that we have from the state of California. We do not know how many of those will be fulfilled, and the 125 that we have ordered that we are simply awaiting shipment. We will continue to monitor this as we do a variety of healthcare statistics, and we'll continue to keep you updated. Now, I want to spend a minute talking about the month of April, and the importance that this month plays. And I would like everyone to just take a pause for a minute as we appreciate the start of a new month in a period of time in which the days all run together, and it's easy to kind of lose track of where we are relative to when this started. We absolutely and unequivocally believe that the month of April is the month that will determine our trajectory as a region. We believe this is the month that will determine if we end up like Italy and New York, or if we find ourselves through a better pathway and a better direction. And so the month of April, we are calling it for it to be a month of aggressive, intentional action. It is time for San Diego as a region to fully and 100% commit ourselves to the actions that are in all of our control. And the things that we do in the month of April will determine which way we go and how we meet this challenge. For those San Diegans who have taken the order seriously, and we know there are so many of you out there that are staying at home, that are ensuring physical distancing of 6 feet or more, that are adhering to the hygiene standards, that are following the medical guidance, that are living every day of your life with intentionality in doing everything you can to stop the spread of this. For those San Diegans, we thank you. We appreciate you and we value you. And we ask you to hang in there and continue those efforts as we move forward. Your actions will save lives. But we also know that there's some San Diegans out there that have not quite bought in to the seriousness of the issue in front of us. They have not quite subscribed to the vital importance. They have not quite understood how their actions impact others. And for these San Diegans, we plead with you and we ask you that the month of April is the time in which we must all come together. We must all make an absolute, unequivocal commitment that we will shoulder our share of the load. And if we do these things in the month of April, then we believe that we can avoid the scenes and situations which you see playing out in other regions of our country. The scenes of individuals standing in line trying to access a hospital. The things that you see on the news or you frequently see, like in the state of New York, where there simply is not enough healthcare capacity because the spread has gotten too great. The things you see where individuals are being triaged in mass rooms. The things you see when areas that are not designed to be hospitals or what have to be converted into hospitals. For our region to avoid this fate and this direction, we have to spend the month of April focused on action, aggressive, sustained action for the entirety of the month. If we do this through the month of April, that will give us the best hope that we can come out of this and return to some sense of normalcy by the summer. If we do not, then the modeling, the statistics, the trajectories could lead us in a very bad place. In light of this, in the coming days, you should expect to see additional action from the County of San Diego to continue our commitment and to really reinforce this theme of the importance of the month of April. There's been a lot of discussion around masking. We saw Riverside County move forward with a change in posture. Up until this point, the general advice and guidance has been for non-symptomatic folks to not wear a mask. As we get more information and more data, there is some movement and effort to say that that posture should change. The state of California and the governor addressed it today in their daily press briefing, saying they would be providing additional guidance today around the utilization of masks, not medical masks, but the utilization of masks for individuals not exhibiting symptoms only when they travel outside their home. And we believe that we will follow the guidance of the state of California, which we expect to receive today. But it is so critically important to underscore that the utilization of a mask is in addition to everything else that is done. Using a mask does not allow you to avoid physical distancing. Using a mask does not allow you to avoid washing your hands. Using a mask does not allow you to go to a non-essential place or gather in groups outside of your family unit. And that is vitally important. It is also important to note that the utilization of masks by civilian personnel who are non-symptomatic should not be medical-grade masks. Medical-grade masks should be reserved for medical personnel and first responders. But there is a movement around bandanas, around homemade masks, and there is some belief and effort that that can play a positive role, and we will provide more guidance around masking in the coming days. We also are working with law enforcement around efforts to increase enforcement. While we are so grateful that the majority of you are following the advice and guidance that have been heeded, the reality is many folks are not. And in the coming days, we will have messaging from law enforcement around their stepped-up efforts to enforce the physical distancing along with the non-essential closures and other types of efforts. And as a county, we are reviewing and looking for additional opportunities to further tighten, clarify, and enhance existing orders to ensure that as a region, we are doing everything that we can. We did start our efforts earlier, both in declaring a state of emergency and public guidances and banning on mass gatherings, and we know that the efforts are working. They are lowering the spread versus if we had done nothing. We have seen some positive results, particularly around flu cases, but the simple reality is we face a horrifically contagious virus with COVID-19, and the reality is this is the point at which we will make a choice on which direction we go. And so we are asking for the public to spend the entire month of April very committed, very focused, very aggressively helping us all come together to stop the spread. And with that, I will turn it over to Dr. Nick Infantidis for his medical report. Thank you.
Thank you so much, Supervisor Fletcher. And in these unprecedented times, I think it's extraordinary and so important that policymakers and physician leaders and the medical community stand one as united. I just want to reinforce, not with fear, but with a sense of seriousness, the challenge that we are facing. And in light of that, as we continue to talk about numbers at a big level, please remember that our community is composed of individuals, and it is with great sadness and regret that I am standing before you today to announce that we actually have 5 new deaths to report today. They are in a 90-year-old female, an 83-year-old male, a 74-year-old male, a 73-year-old male, and a 71-year-old male. Our hearts, our prayers, our thoughts go out to each and every one of their loved ones. We are very sorry for your loss. For the sake of clarification, I also want to make sure that everybody is aware, and especially those who track the numbers so very carefully, we are now at a total of confirmed cases for San Diego County at 15. But that includes something that was left from yesterday, and that is that we have reclassified one of the probable causes. Yesterday we reported 9 confirmed plus 1 probable. That 1 probable is now confirmed, bringing yesterday's total to 10 with the additional 5 today. That brings the loss of life in our community from COVID-19 to 15 individuals. I'd like to go through the numbers as we have become accustomed to doing, beginning at the global level. The novel coronavirus, which is causing COVID-19, has resulted in over 922,000 positive cases and nearly 47,000 deaths. Nationwide, here in the U.S., we are at 206,000 confirmed cases and nearly 4,400 deaths. Statewide, we are approaching 9,000 confirmed cases and 184 deaths. And as was just mentioned, here in San Diego, we now have 849 confirmed positive cases, which is an increase from those we reported yesterday of 115. Of the total number of cases, 60% are in the age range of 20 to 49. Gender breakdown, 45% are female, 54% are male, and 1% the gender is unknown. 19% have been hospitalized, 8% have been admitted to the intensive care unit, and unfortunately we are now at 1.8% of the total number of cases having passed away from complications. I'd like to now turn quickly to some of the outbreaks, and because of where we are in the progression of this situation, we are now starting today only going to be reporting out on the positive confirmed outbreaks in our community. We have 2 additional outbreaks to report today, bringing the total to 11 for our region. One of them is at a skilled nursing facility in El Cajon, where we have 1 confirmed case and 3 individuals who are symptomatic and persons under investigation. And in addition to the 3 previous community-confirmed outbreaks, we have 1 new confirmed outbreak at the San Diego Police Department that involves just 2 cases, an officer and their partner that are both positive. And I just want to say ahead of time, if there are any questions related to that, they will be referred to the City of San Diego. I'd like to now call for the graphic that we have prepared just to drive home the point of the fact that we are earnestly, and I mean earnestly, working on the concept of modeling. And I want to make sure that everybody fully understands when we talk about modeling what exactly it involves. And this graphic is a very simplified but very poignant summary of what we are trying to accomplish. In the absence of any of the interventions, the orange shaded circle reflects the number of cases and disease burden that we would have regionally, which would lead to both significant loss of life as well as, if you can see that fine dotted line, our healthcare capacity. And as Supervisor Fletcher has referenced, and what is the challenge that we are focused with all of our hearts and minds are. Unfortunately, in parts of the globe and in our own nation, there are regions where the demand has overburdened this health care system's capacity. We will not, to the best of our abilities, allow that to happen here in San Diego. And so we are, with all of these protective measures, these societal interventions, and the additional ones that Supervisor Fletcher just referenced, we are hoping to lower that burden and that curve and to have a more gentle slope. Dry-eyed realism that may extend, as is depicted here, the period of time in which we will have to not just live but thrive as a community under this new paradigm. At the same time, we are looking to increase the capacity, and I keep making mention of it as we all do. We are so blessed to live in a community that right now is as optimally united, collaborative, integrated, and communicative as one could ever hope for. We are working tirelessly at various levels of increasing our capacity. So while we flatten the curve, we increase our capacity, thereby posturing ourselves to be there for you when you need it the most. The last thing that I want to say is what a collective effort is involved in doing this. We have different parts of our own county enterprise, epidemiologists from my team, epidemiologists from public health. We are in consultation with national and local academic centers, and today, through relationship, I've even reached out to a master actuary, Dave Axine, who is helping us with analyzing these things. We want to try to get this as right as possible, but acknowledging the reality that there are so many moving parts, there are so many factors involved, but we will do our best in order to be informed. And then the last thing, just to reinforce, if I may, because it is so important in terms of what Supervisor Fletcher said. This month is a critical month for us. We all have to be regional health stewards. We have to come together individually for the collective good. We cannot yet promise a date where life will be back to normal, but our capacity to arrive at that date as soon as possible will be determined by all of us as a community of one working together towards that goal. Thank you very much. I'd like to now invite back up Chairman Cox. Thank you, sir.
Thank you, Dr. Nick. Before we get to the questions, there's been some new developments that were in the planning stages that are now being implemented at the San Diego Convention Center. And to briefly tell us about that, I wanted to call back up Supervisor Fletcher.
This morning I joined Mayor Kevin Faulkner, Councilmember Chris Ward, the Regional Task Force on the Homeless, CEO of the Convention Center and Homeless Providers, as we announced the opening of the Convention Center. We've taken a number of actions since the outset of this to protect vulnerable communities, seniors, skilled nursing facilities, a variety of others, and a large focus of that has been efforts around the unsheltered and the homeless. Today we took a big step forward in opening the Convention Center with initially around 900 cots available in a physically distanced manner. This gives us the opportunity to provide physical distancing in a number of the shelters throughout San Diego County. There is great concern of individuals who live in congregate care settings that the prevalence of the spread of coronavirus could be very severe. Early, we've mitigated that by putting public health nurses in all of our shelters, public health nurses and homeless outreach teams looking for temperature, symptoms and signs, along with the motel rooms that be available. But today's actions around the Convention Center are a very positive step forward, and I think that San Diegans should be pleased to see that a convention center that usually showcases the best of innovation and entertainment and hospitality is now going to showcase the very best of compassion, healthcare, and better outcomes in protecting these individuals. County staff will be on hand there to provide mental health services, behavioral health services, along with doing our part around public health and screening these individuals. And we will continue to work collaboratively with the City of San Diego, the Regional Task Force on Homeless, and all of our homeless providers to protect this vulnerable population.
Thank you, Supervisor. We'll go into the questions now. I think we have 4 questions lined up, 5, I guess, now. So as we call you up, Ken, if your name and outlet are not mentioned in the introduction, please do so. We'll take the first call now.
KPBS, please state your name and question.
Hi, this is Matt Hoffman calling from KPBS. You guys started breaking down cases by zip code. Obviously, we can see areas like Hillcrest, 57 the most, La Jolla, 26, Normal Heights, 23. I had 2 questions, but first, what does this data mean to you guys at the county? Dr. Nick, if you could answer that.
Okay, Dr. Nick will answer that.
Feel like I'm getting called out there, Matt. Look, and I don't want to be dismissive, but I'm going to be honest. To me personally, that information does not mean very much. We are at a point with regard to regional transmission. There is no correlation, by the way, of whether or not, based on where somebody resides, that is where they got infected. This virus knows no zip code limitations. And so I do think that there is a potential prioritization by some communities and so forth in terms of having that data clinically, and I will say logistically, at least from my perspective as a clinician, it really doesn't make that big of a difference. The things that we are doing in terms of the social distancing, and absolutely there are parts of our community, regions of our county, where there are disproportionate burdens of individuals who reside, who have chronic medical conditions and who have unfortunate and difficult socioeconomic status. But the virus knows no limits in terms of zip code, and the things that we are doing on a regional basis, I think, are really the main priority. So I think this is a balancing act as your public stewards of providing data that's been asked for. But to answer your question specifically, Matt, practically, to me at least as a clinician, it really doesn't make that big of a difference.
Gotcha. And then for like someone who's a resident, like if somebody sees the zip code breakdown, like if they live in the Hillcrest area, for example, how should people who see these breakdowns be interpreting this data?
That we are tracking the residents of where individuals who have been confirmed as positive cases, where they reside. Other than that, absolutely nothing.
Thank you.
Okay, let's go to the next question.
NBC7, please state your name and question.
Hi, good afternoon. My name is Lauren Coronado, and the question I have is in regard to the partnership with Rady Children's Hospital and the Rock Church. How soon can first responders and healthcare professionals receive PPE, and just how much?
Okay, Pastor McPherson's going to answer that question.
You might be best to answer that question. As far as I can understand, if you have PPEs, you can call the number that was given, and then it'll be reevaluated, and we'll receive it immediately. You want to answer that?
Yes, thank you. We have received a number of calls for people wanting to donate personal protective equipment. And thankfully, Rady's Foundation has stepped up along with the Rock Church in order to receive all that, collect all that. It will be brought into our warehouse in the county, and then we will evaluate the best use of that. If we can confirm that this is appropriate for healthcare workers, that's where it'll go. If we cannot, then it will also go to the need, as Supervisor Fletcher was talking about, masking, so they can protect others from someone who may be symptomatic. So that's where it's going to go, and I believe that was your question, so thank you.
Yes, it was. Thank you.
Okay, let's go to the next question.
KUSI, please state your name and outlet. And question.
Hi, this is Hunter Sowards with KUSI. Oh, yes, ma'am. I was just wondering if there's a way to track the number of individuals in the county who have possibly recovered from the virus. And then another question for Supervisor Fletcher, I knew we had some pending cases among the homeless, people who had been tested, and I was wondering if we were able to know those results.
You want to do it first, Dr. Nick?
I will just quickly answer the aspect with regard to tracking those who have recovered. I think we are early enough in this process for us to this point. It hasn't been a priority. Obviously, there are certain key things that we are prioritizing. You hear about some of those. You've seen some of those on the graphs. But as the number of cases increases and the denominator becomes more meaningful, though it's starting to get there in the 800s now, we are evaluating both our capacity and ability to quantify those results. Supervisor, were you going to address the second part, sir?
The day before yesterday, we were asked if any homeless individuals had tested positive, and 2 days ago, that was not the case. No one had tested positive. Yesterday, we did have a few positives, so we just shared that we had had a few positives. We do not break down the number of positive cases by occupation, nor do we break them down by housing status. So we shared yesterday that a handful of individuals had tested positive to make sure it was clear from the day before the change that had happened. But moving forward into the future, we don't plan to break out and classify individuals, the percentage of positive cases by sheltered or unsheltered, just as we don't break them down in other ways. We will continue to provide zip code breakdown, age breakdown, the other types of information that we've shared, and we'll continue to look for more opportunities, but we don't have any additional updates on the number of unsheltered versus sheltered individuals who have tested positive.
Thank you.
Okay, let's go to the next question.
10 News, please state your name and question.
Hello, this is Kimberly Hunt. I have a question and then a quick follow-up. One of the hotels that you're using for COVID-19 patients and the homeless is the Crown Plaza in Mission Valley. And the scene there the last couple of days is roped off parking lots, sheriff's deputies on scene, people in protective gear. Is there something going on there, or will this be the scene at every property that you're using?
Okay, Supervisor Fletcher.
Thank you for the question. The reality is we have a number of motels and hotels that we use to medically treat people who have been medically diagnosed with this illness. It is not helpful to the patients who are getting treatment, nor is it helpful to the county as a whole when we publicize those locations, nor when we have outlets show up there, because it upsets the patients who are there who feel like their privacy is being violated. It is unfortunate in that case we had to divert law enforcement that ought to be doing something else to try and get people who should not be on that property, who are not COVID positive, who are not healthcare workers, who are not county workers, to leave that property. And so we ask for the public's help and cooperation, and that these are individuals who are experiencing illness. These are individuals who are going through a difficult time. These are individuals who would love to have their privacy respected, both at the treatment that they're getting along with the location that they're at. And so we're asking for the public's help. We are obviously contracting a number of motels to provide these services and these treatments, and it is our hope that we could avoid folks who don't have a reason to be at these facilities from going to these facilities. It would also be appreciated by law enforcement, so that instead of enforcing who should or shouldn't be there, they could focus on their job of keeping us all safe. Thank you.
Supervisor Fletcher, how many rooms are filled now in the county that you've procured?
If you'll back up the presentation to the slides we presented, you can see the daily update of the totals. We provide those totals on public health rooms and Regional Task Force on Homeless rooms each and every day. So it is 102 of the public health rooms are occupied, and 183 of the Regional Task Force on Homeless rooms are occupied presently. And we'll update that slide every day moving forward and make that information public every day.
Thank you.
Thank you.
Okay, next question.
KPBS, please state your name and question.
Hi there, this is Shalina from KPBS. So I was wondering if you could explain a little bit more how testing kits get distributed throughout the county. how is it decided which hospital providers get these testing kits? Do they have to contract out through labs? Just, do you mind explaining that?
Dr. Nick will answer that question.
Yeah, thank you very much. You have heard in the national media over the last few days the rapid development and deployment of these testing kits. To my knowledge, and I'm not 100% knowledgeable about anything that's going on, we don't yet have any of those here in San Diego. But from a testing capacity, I would explain it in the following way. There are three broad categories. We have our own public health laboratory with specialized equipment and the capacity to do testing there. There are health systems like Scripps, Rady's, Sharp, others, Kaiser, who have the capacity to do testing within their facilities. And then thirdly, you have commercial labs, and there are three, at least that I'm aware of, that are also part of this effort. The determination of where somebody gets their test is dependent on the context of who their healthcare provider is and the referral basis and so forth. There has been some discussion and also some media, if you would, coverage related to things like these drive-in facilities. Folks, it is important. Other parts of the world do this differently, but it is important to be clear that here in San Diego, we do not have any sites where you can just drive up on your own and obtain a test like you're ordering a latte. That is just not an option. Some of those facilities are referral-based, and there are a variety of them that includes established, if you would, individuals who are part of medical groups associated with the major health systems, but there are also some of those efforts going on with regard to the federally qualified health centers and referrals that are made for individuals to go to those drive-through destinations and get their tests. So I hope that gets to the point of your question. I wouldn't think of it as distribution of kits as much as the availability of tests in the public health lab, in the health system lab, and in the commercial lab, all of which is coordinated in terms of ordering, reporting, and follow-up with us in public health. Okay? Thank you.
Sure. I do have a follow-up question. So for the facilities that, I guess, don't have resources to contract out to commercial labs that are doing the tests, or are large-scale hospital providers, how are they able to do testing for people in those neighborhoods? And I guess this relates back to the zip code data, because we are seeing like higher clusters in neighborhoods like Hillcrest, for example.
Well, and I will tell you that the case could be made that based on the fact of where we are in this process, that you may actually be seeing a reflection of a higher number of quote-unquote cases based on the increase of availability of access to testing in those areas, rather than that is a sicker population where the disease burden and the rate of transmission is any greater. We have no evidence of that whatsoever. To answer the first part of your question, because it's an insightful one and it is true, not every major health system, at least currently, as of at this moment, has the testing capacity within their own health system lab. But that is the brilliance and the amazement of San Diego. There is collaboration happening at the hospital level, and through our regional health information exchange called San Diego Health Connect, for those lab results to be communicated between different facilities. So I am confidently able to say, anybody in our region who needs access to a test and is appropriately referred to one will receive one. Thank you very much.
Okay, that completes our call-in questions. We'll go to the first text question, and I believe that's dealing with homeless, and Supervisor Fletcher will answer that question.
Thank you, Chairman Cox. This is from Claudia with Univision. And keeping in mind that there are 900 cots that have been set up at the convention center, she asks how many people were transferred to the facility today.
Thank you. In terms of the specific numbers that were transferred, I'd have to direct you to the City of San Diego and the Regional Task Force on Homeless. They are taking charge with the setup, the structure, and the transportation of individuals there. The county is playing a role both as a financial supporter of the effort, but also in terms of the staffing around mental health, behavioral health, and other services. But it would be their news to share about how many people were moved in on a day-to-day basis.
And she has a follow-up. In addition to the convention center, what other places are being considered for a mobile hospital? San Diego County Fairgrounds, perhaps? Universities such as UCSD or SDSU?
Well, we haven't identified or publicly shared any locations that are being considered for mobile field hospitals. There are two that we have requested from the state of California. One is a 250-bed mobile field hospital, essentially a kit. It comes with all of the stuff that you need for a mobile field hospital. Army Corps of Engineers is assessing a variety of sites and will determine what site is best, and then when we're at a point we can share that, we will. Regardless of where those beds are sited, they will be a regional asset that are designed to help the entire region. We've also requested, separate from that, a 25-bed hospital unit that comes not only with the equipment but with the staffing, and we will do a similar assessment of the most available sites, and that too, regardless of where it's placed, will be a regional asset to serve our entire region. And so when we have potential siting locations, we will share those. One quick point on the zip codes, just to add on to what Dr. Infantiti said. Yesterday, when we said we were going to make data available by zip code, we were very, very clear that this data does not really tell you much. Because of the continued limitation in testing, we have repeatedly said that the number of actual positives is probably 10 times greater than what we are able to report. As we move into the future with more testing, that delta will narrow. But the reality is we believe there are positive cases in every single zip code in San Diego County. Some areas may have greater access to health care and a doctor who can order that test, and we may have a little bit higher rate because of their access to testing. But if you live in a zip code that has a lot of positive tests, then what you ought to do is stay at home and wash your hands and maintain physical distancing from other folks. If you live in a zip code that our report says doesn't have any, what you ought to do is stay at home. Physical distance, wash your hands. The reality is this is throughout San Diego County, and you really can't draw a lot of conclusions from the zip code data. We were happy to share it out of an effort of being transparent, but as we stated yesterday, I would not try to deduct too many things from that, particularly at this early stage. Thank you.
The next question has to deal with bed counts. I'm going to ask Dr. Infantidis to respond to that question.
This question is from Taryn Mento from KPBS. On March 26th, officials shared a chart that showed with interventions, we'd reach a bed occupancy of 50% by early May. Is that still the path that San Diego is on?
If I could, I'd like to call up the graphic that I showed at the end of my prepared comments and say this. Look, we are doing everything we can to be responsive to your felt needs, the data requests that we have, and the commitment of transparency that we have as your local stewards. That graph that was discussed on the 26th, I would say, is a preliminary one. And so we are now in the process of much further refinement. And it reminds me, as we talk about field hospitals and things, I want to take the opportunity yet again to emphasize the 3S perspective in terms of staff, the most important, stuff, and structure. Just over the course of the last week, in meeting with our regional healthcare leaders and CEOs and CMOs, the responsiveness to those dialogues of the increasing capacity of our healthcare system locally does not make those initial graphs inadequate, but they are probably not as accurate as the ones that we will continue working with into the future. So the concepts are applicable. We are trying to lower the burden of the timing of spreading things out, but also increasing the capacity of our healthcare delivery system at all levels in order to make sure that we are always proactively positioned to make it positively as likely as we can that those who need acute, perhaps more involved health care will be able to have access to it.
The second part from Taryn. Let me just locate it here. The county put out its influenza watch today that shows 7% of emergency room visits are people presenting with influenza-like illness. Does that figure include people presenting with coronavirus-like illness?
Yeah, that's a very good question. We call that the ILI symptoms, and that is something that we are tracking constantly. That is part of the challenge that we are facing with this novel coronavirus. The symptoms are very, very similar. And so we are at a point now where the influenza season by no means is it over, but it is dissipating. But with the increasing numbers of confirmed cases and transmission happening in our community, yes, it is very likely that some of those ILI cases include individuals who have coronavirus, which is part of the reason that we are doing the screening and the, if you would, virtual consultations that physicians and nurses are doing with folks in the comfort and quarantine and isolation of their own home to make sure that those who have those symptoms, who need the testing, perhaps they're not at a point of acuity that they should come to the emergency room, that can be coordinated in all the different mechanisms that we've discussed. Okay?
Thank you.
The next question deals with beach closures, and I'll ask Supervisor Fletcher to respond to that question.
Okay, let me pull it up again. This is from Paul Sisson with the San Diego Union Tribune. There are a few beaches that remain open in San Diego County. Should they close?
Well, presently, our public health order tells jurisdictions that if they cannot maintain social distancing, physical distancing at their beaches, parks, or recreation centers, then they shall close. But that decision is ultimately left to the jurisdictions that control those entities. Some have chosen to close them all. Some have chosen to remain open. At the county, we have closed a number of trails. We've closed contact services, playground structures, recreation centers, other areas where we are confident we can maintain physical distancing. We have left those open. So it really is, at this point, a decision for each jurisdiction to make. But the public health order is clear that if jurisdictions cannot ensure physical distancing, then they shall close. But at this point, it is still a decision to be made by each jurisdiction.
Okay, the last question we have is on a cruise question, so we'll call Dr. Nick up to respond to that question.
Yes, this is from Jennifer Kastner from ABC 10. Passengers who disembarked from the Celebrity Eclipse Monday were able to fly out on American Airlines flight Monday night. Air crews were told Monday that the cruise passengers were cleared. Air crews later learned that cruise passengers got a letter dated Monday that they were exposed to one cruise passenger who tested positive. Cruise passengers were told to self-isolate and not travel. Question is when did Celebrity issue the letter, and why wasn't American Airlines notified before allowing its crew to fly with passengers who may have been exposed? And was the cruise ship passenger who tested positive seen in the ship's infirmary?
Let me just answer this by saying the following, that those are a lot of detailed and appropriate questions. Dr. Eric McDonald, who would normally potentially be in a position of responding to some of those, is, as we speak, unable to be here because of ongoing conversations happening with Port, State, CDC, national leadership in terms of this unprecedented issue. I truly, it's not hiding anything, I just don't have any of the specific answers. Your questions with regard to timing, as far as Celebrity, I would refer to Celebrity. As far as airlines, I would refer to the airlines. Truly not information that I have available. I'm sorry.
That concludes our questions for today, but I wanted to take an opportunity to remind everybody that today is Census Day, April 1st, across the United States. And even during a crisis like this, it's important for all us to fill out the census because among many things, it helps to bring additional funding and aid to our region. And it's obviously very easy to fill out online. And all you need to do is visit my2020census.gov. Finally, I want to let everyone know that today is also day one of the Live Well at Home 30-Day Challenge. You may recall that I spoke about Live Well at Home online resource to help everyone that is following the public order to stay at home. Live Well at Home offers videos, plans, and other resources so that you can stay fit and socially connected. The Live Well at Home 30-Day Challenge will offer daily challenges to help you stay healthy and in the right frame of mind. So I challenge you to join the challenge. Just go to livewellsd.org or follow Live Well San Diego on Facebook, Twitter, or Instagram. And again, as always, live well, and to stay well, stay home. That concludes our media briefing for today. We'll be back tomorrow at 2:30.